Hello, everyone. Welcome to WDHT's Off the Cuff, where the headlines come to life. And we are so fortunate today to have who I call the dynamic duo. We have with us State Representative Abdullah Hammoud from the 15th District, and we have Wayne County Commissioner David Knezek. And they're going to answer some questions for us in regards to what's going on the state level and how us as citizens can actually help the process. So welcome, gentlemen. Thank you for taking this time to be with us and really give us your expertise and your vision about what's going on.
Thanks for having us.
Thank you. Thank you so much for having us.
Welcome to WDHT TV. You're both no strangers to us at all, but you're usually in the studio. But we're going to make this work. I really, my first question, I guess, and the question everybody has on their minds, the state needs to continue to operate. There are vital issues that need to be addressed. How are you dealing with the virtual aspect of doing business these days, government-wise?
I'll defer to the rep. I'll let you go first.
Yes, Commissioner?
Yeah. So I'll have the short answer. Unfortunately, the State House and State Senate, or the legislature, has not adopted a means of working remotely at this point. We have introduced a resolution asking for a robust policy guideline to be put together so that we can begin to work remotely, because there's a lot of work to be done. However, it's never been done before. There are a lot of questions that still need answers, and unfortunately, there has been a resistance somewhat by some in leadership about adopting a remote policy. So we don't have a remote policy at this point. We go to Lansing on an as-needed basis currently to do what needs to be done and return home.
Do you practice the social distancing issue as well when you're in session?
Yeah, I mean, yesterday was the most, was the first vote that we've had come together. I guess the second time we've come together since the COVID outbreak, really, here in Michigan. And it was, 5 to 7 members at a time entering the chamber, showing that they're there in attendance to get quorum. Many members did not show up out of fear of exposure if they were high-risk individuals.
Sure.
And then it was we only had one vote yesterday, but it was a voice vote. So individual members actually did not need to vote yes or no. In a voice vote, the Speaker of the House or the Senate leader determines. I guess I think it's different in the Senate, but in the House, the Speaker determines which way the resolution falls. Either in majority favor or majority against.
So the individuals that did not show up, do they have a process of having their voice heard or having their vote count?
At this time, the state legislature does not have a policy.
Okay. Commissioner, how about the Wayne County Commission? How is that functioning during this virtual age?
Yeah, so I kind of look at it from the commission perspective and then from the county operations as a whole. And as folks know, for any county employee who's not determined to be an essential employee under the executive order, we've had those employees furloughed for a number of weeks now. It started as a 2-week furlough. It was extended into a second 2-week period, so 4 weeks total, paid furloughs. And the same is the case with our employees on the commission. And so my staff has all been furloughed, the commission staff has all been furloughed, but what we're trying to do is to still maintain, to the extent possible, county operations. And so one of the things that the executive order provides for county government and local government is this ability to meet remotely. The same thing that the representative talked about is not being granted by the legislature to the legislature. The commission has the ability to do through the executive order. And so we had to have a couple practice sessions on Zoom, and I told my more experienced colleagues that I'm going to give them a millennial award for figuring out Zoom and how to mute their phones while they're participating in the meetings.
Yeah.
But we've had 2 meetings already as a Wayne County Commission, conducting all of our business virtually, using Zoom as our platform, but then also making sure that residents have the ability to participate in those meetings as well. One of the pieces of the executive order is to make sure that the public's ability to see what is going on, to participate in those meetings, is not infringed upon. So whether the public wants to call in just over the phone and participate, by listening and speaking, or if they wanted to actually log into the actual meeting through Zoom, that's all available. And so the plan at this time is to continue moving forward with our digital meetings so that the business of the county can continue to move forward.
And I know that's very challenging. As a judicial tenure commissioner, we've actually had our 2 meetings via Zoom, and we were up to do a hearing and actually tried to be able to create that via Zoom, and it's almost impossible to make sure that all the aspects are addressed. So I can imagine what's going on within the government base. Representative Hammoud, you have been sending out some real vital information. You created a group to be able to disseminate a lot of the pertinent information that is happening within the COVID-19 platform. What additional information can you give us in regards to resources, in regards to what people can do if they're in dire need? Who do they go to? Who do they call? Is there a 911? I need food. I need medical attention. I don't want to go to the hospital. I mean, what kind of resources do we have?
Yeah, so we're trying to meet people where they are. And so immediately upon knowing that the first cases arrived in Michigan, we launched several group chats, which is what you were referring to, where we disseminate information strictly about resources available to small businesses, to individuals, helpful guidances, helpful hotlines, whatever it might be. Secondly, we also mailed out a letter with some helpful diagrams to show you how to prevent contracting COVID-19
Yes.
and what to do if you do have COVID-19, along with a magnet that has all the helpful resources numbers that you could possibly need during this time. Some of those numbers include the Beaumont hotline, the Wayne County hotline, the state of Michigan hotline, 211 with United Way if you're looking for any resources or have any basic questions. But also extremely important during this time, the unemployment agency hotline. For many individuals who are unemployed or have experienced a decrease in loss of hours and are seeking some assistance along those lines. Largely at the state level, resources we're providing pertain to unemployment. At this time, if you go to michigan.gov/UIA, you can apply for unemployment if your place of business has closed because of COVID, if you've experienced loss of hours, if you were laid off, or any reason really pertaining to COVID-19. You can apply through the Michigan State website. And that website, once you submit your application, that is the same website or the same application they'll use to administer the federal resources for unemployment, the additional $600 per week. So once you apply to the Michigan website, you don't need to apply again. Those resources will hopefully be appropriated to you once they're made available to the state. More than unemployment, I know that the governor also allocated a lot of funds for small businesses through the means of grants or loans. And I actually leave County Commissioner Knezek to speak to that in further depth as the county was selected. I think they were the largest grantees selected in the state of Michigan to provide those resources for small businesses.
Commissioner, do you want to add to that?
Yeah, that's great. And like the representative said, I think what all of us are settling into right now is what are we all able to do at our own individual levels. We want to make sure we're getting as much information out to the public while also staying in our lanes at the same time. And so, when it comes to unemployment, when it comes to the things that the rep talked about, he's knocking it out of the park with the work that he's doing at the state level. The federal government has brought in some dollars by way of grants for small businesses to help them with payroll, to be able to meet their expenses, to make sure they can stay afloat throughout this crisis that we're going through. And so what we're doing at the county is trying to identify those gap areas where we can appropriate dollars to make sure that nobody falls through the cracks. And so a good example of that is a number of these federal dollars that are flowing in through the county for small businesses. There's also a requirement that those businesses be in certain census tract areas, certain low income areas. And what you find is across the county, it doesn't matter where you're at, businesses are being forced to close and businesses are being shut down and people are being put in a really bad spot. And so what we did last week was to expand upon the federal grant dollars that were coming in by appropriating an additional $2 million for any business that doesn't qualify per the federal guidelines. That way, every single business that's eligible or is in need across Wayne County is eligible through the programs that we're offering. And of course, our health department is obviously trying to kick out as much information that we can on a daily basis in terms of updates about what's happening at the various levels of government. And again, just trying to make sure that we can be there for residents and for small businesses as this thing progresses.
Well, I'm going to take advantage of this situation and ask you about nonprofits because I'm involved with the Wayne County Dispute Resolution Center, and we're definitely trying to stay afloat. And we have a lot of part-time employees. So what's in place for nonprofits, and how to make sure that our employees are taken care of? Really, I mean, across the board, basically, there's so many nonprofits out there that are really struggling right now. What's in place for them?
Saying nonprofit actually made me think of something I wanted to share, and that is United Way phone number 211 is really a great catch-all for residents in Wayne County. If you are looking for food, if you're looking to get tied into a local nonprofit in your area, we always try to push that number as a catch-all for residents to just call in, tell us what the issue is, and let United Way get you connected to the appropriate folks that are in your community. As it relates to nonprofits, at the end of the day, nonprofit businesses are just that, they're businesses. And so they're still eligible to apply for the same type of programs that are being made available across the county right now. We're seeing, and I'm trying to get it brought up on my phone here as we're talking, but there are various different programs for small businesses that are available. Some are grants that you never have to pay back. Others are low interest loans that you have a period of time to pay back once this is all over and done with. And so we're encouraging folks, like with unemployment insurance, to make sure that you're calling, make sure that you're applying for the need or for the benefit, and then to let the folks who are on the other end of the line at the county walk you through what might be the best fit for you. Program A might be a better fit for you than Program B. We at the county are happy to direct you in the right direction.
If I can just supplement what
Sure.
what David said real quick, Zaina Al Hassan, who is one of the lead counsel with the Kresge Foundation, created a
Yes.
wonderful document. And so if you go to kresge.org, they actually
Yeah.
created a mission, money, and markets nonprofit guide to accessing capital through the 2020 CARES Act. And so it's a wonderful guide for nonprofits. It's available on kresge.org again, and it has all the available resources currently that nonprofits can tap into, a lot of which Dave has already spoken to.
An invaluable resource. Also, we've been posting that all over because it's really has some incredible information on there. Rep. Hammoud, we talked a little bit about the emergency condition in place. So the governor has extended our stay-at-home, shelter in place until April 30th. Is that correct?
No. So what happened was, and the media actually reported this incorrectly. So,
okay.
Yeah, what had happened was the governor asked for an extension to the state of emergency declaration.
Right.
To the legislature. That was the resolution that was voted on yesterday. Now, the state of emergency, when it's declared, this is what provides the governor with the tools she needs to enact strong public health interventions to help curtail the pandemic.
And the stay-at-home initiative.
Something like the stay-at-home is a power that she basically has because of the state of emergency declaration. Now, our stay-home measure is currently set to expire next week, the 13th of April, I believe. She has alluded to the possibility of extending the stay-home measure. Now, if she wishes to extend the stay-home measure, she can only extend it to the length of the state of emergency, which is to April 30th. So if she does extend it, I would imagine she's able to extend it to the end of April. And if she wishes to extend the stay-home measure past April, she would first need approval to extend the state of emergency declaration and then subsequently enact a new executive order to extend the stay-home measure.
So what happens if there is a disagreement between the legislature and the government in regards to extending it to the 30th?
So with the state of emergency declaration, particularly, there was a disagreement. The governor asked the legislature to extend the state of emergency for 70 days up until June 10th, frankly, the first week of June. Republican leadership disagreed with that, and they wanted more short term. They want to have more frequent conversations and reassess more frequently, even if it goes against the science and the evidence and the research that's published out there about how long we really will be combating this. And so they extended the state of emergency only to the end of the month, as opposed to the 70 days requested by the governor. So there is disagreements. Fortunately, though, we were still able to come together and still extend the state of emergency, even if it was a very short period of time. And I'm hoping that more bipartisanship will stick around, because during, at this time, we really have no time for political bickering. We got to get together and put the people first.
Well, I hope they listen to science more so than the political platform.
I hope so.
All we can do is hope, Rep. Commissioner Knezek, I know there's been a lot of price gouging that we've been seeing, incredibly an increase. I know we were looking at actual rubber bands this morning on one of the website, and it was like $15 for like 12 rubber bands, larger ones, but still, I mean, that just seems exorbitant to me. So there's a lot of individuals taking advantage of the situation. What's in place to address that? I know the Attorney General has called out a lot of people, and she's also called out a lot of people within Wayne County as well, and kudos to her. I mean, she is definitely on it. But what's in place to be able to address these things? And the things that I saw in terms of price gouging are more of the, the larger chains and what have you. So what are we doing to address that?
Michigan does have the Consumer Protection Act that
Right.
provides consumers with some level of protection against price gouging, regardless of whether or not we're in a period of crisis. I think it becomes all the more heinous when we're in a crisis like this and you see businesses who are trying to gouge people on milk, on eggs, on toilet paper, you name
Sure.
it. It really is a shame. We had a report out of the west side of the state, a hardware store that was taking packs of 10 masks, breaking the pack open, putting them in individual plastic bags, and trying to sell each mask for $20 a pop. You used to get 10 of them for $20.
Wow.
Now they wanted to be doing 10 for $200, So it is a shame. And so what the Attorney General is encouraging folks to do is report those to her office. The Attorney General has the legal and the statutory authority to intervene in cases of price gouging like that. If you go to the Attorney General's website, it's just www.michigan.gov/AG. There's a consumer complaint form right on that homepage. Once you fill out that consumer complaint form, it's going straight to our attorneys. If we get a number of complaints about the same business or an incredibly ridiculous example that comes in, we'll send investigators out there to check that out, to verify it. And then that business will get a letter from our office notifying them of what's been reported to us, gives them the opportunity to remediate the problem, to respond to us. And then if not, the Attorney General's office will take legal action against that business. And so we've had some cases in the last couple of weeks here where Menards had to get a very strong letter from our office. They subsequently apologized and backtrack on what they were doing. We've had other businesses like the Home Depot who are doing the right thing. They're limiting the number of people in their stores. They're maintaining safe social distancing. So while the Attorney General wants to be tough on those folks who are breaking the rules, who are gouging residents, she also wants to make sure that we're lifting up the businesses who are doing the right thing. And I also think it's important to talk about, from a consumer protection standpoint, the number of scams that we're seeing across the county and the state right now when it comes to folks saying, your identity has been stolen, call us to get it restored, or your identity is in trouble, you're not going to get that check from the federal government, call us. And so we also want to make sure that folks are referring those type of scams to our office. We're generally able to track down where they're coming from, where they're originating, and to reach out to those folks and issue a cease and desist letter to them as well. And so, again, at the same time as everyone's trying to navigate this previously unheard of territory, they're also being preyed on by bad people who are trying to do bad things. And so we just want to, in general, remind folks that the Attorney General's office is there for you. They see themselves as attorneys for the people of this state. And so if you've got something that you're just not sure of, or maybe it doesn't sit right with you, or it's just downright obvious that what's taking place is wrong, pick up the phone, give us a call, and let us do what we do best at the AG's office.
Absolutely, absolutely. And I know that they're definitely on it. Representative Hammoud, I mean, there has been, Detroit, Wayne County is really almost at the epicenter, following in the footsteps of New York in regards to all the cases. And worldwide, I mean, percentage-wise, I think we have more deaths than globally. What, in terms of the United States, of course, but Detroit is being tallied on a separate level, and then Wayne County. But we do have more cases. I think are we number 3 or number 4 within the country in regards to cases? What are we doing about that? What are we looking at? Why is that happening? And what do we have in place to address that, if that's even a question that you can tackle?
Yeah, I'll do my best to infer based on all the scientific research and evidence and what it's pointing to or suggesting. It's important to highlight that within the state of Michigan, the African American or the black population makes up about 13-14% of the Michigan population. But if we're looking at percentage of cases, they're upwards of 35%,
40%.
40%. If we're looking at mortality rate, they're around 40%, 41%. More amongst men than women. And I think it's important to highlight and to speak to as to why we believe this is to be the case. And it's still early, but I think we know there's a lot of factors that put you at a stronger predisposition for contracting coronavirus. Poverty, first and foremost, access to clean water, access to healthcare, access to transportation. All of these factors, which have been plaguing minority communities, largely Black communities throughout Michigan and other places across our country, have put them at higher risk for contracting coronavirus. We've seen less likely to have access to testing also in these areas, especially when you're talking about a condition that presents asymptomatic 20 to 25% of the time. Individuals walk around without testing, but have coronavirus, infecting others who may react differently to the infection, leading to a greater increase in the infection rate, also leading to mortality. So it's very unfortunate. I think this COVID pandemic has really shown all the shortcomings of government. It has really identified all the places that we need to begin to address, more than just the infection rate amongst Black communities, Black and brown communities. We need to talk about education and the resources that they have, so that, for example, distance learning is something that's applicable and achievable in communities all across the state. It's not fair that in Oakland County, those school districts might be better equipped and more prepared to offer education and distance learning, but in communities like Flint, Saginaw, Detroit, not so much. And so I think there's really been a removing of the veil, a real raw exposure of all that is wrong with government where they have not provided, and really how we have marginalized, I shouldn't say we, but how the government has marginalized communities of color for a long time. And this virus is nothing more than exposing.
Absolutely. Absolutely. Commissioner, PPEs, they're not readily available. To me, that's like that reminds me of being in a very poor third world country, not having enough personal protection gear for our frontliners and our healthcare workers. Now, me, as everyone else, watched the president say that it was not the responsibility of the federal government to supply PPEs to the various states. And, as you see, Jared Kushner called them our stockpile. Can you sort of put that in layman's terms and explain really the reality and the truths of those statements?
Well, first, I'll simply confirm the reality of what you said in the beginning, and that is we have a significant shortage of PPE here in the state of Michigan. My sister, as folks know, is a nurse at Henry Ford Hospital downtown, and she's being asked to use the same mask for 7 to 14 days at a time, which we know is not the standard or acceptable within the profession. And so, what for me is really encouraging is you're seeing companies like Ford, like Stormy Cromer in the Upper Peninsula really stepping up. I think I saw today on social media that it took Ford 7 days to make the first 1 million face shields to ship across the country. It took them 4 days to make the next 1 million. And now they're looking at ramping things up to 1 million shields a day. And so, to your latter point, it's incredibly frustrating, I think, to the rep's point earlier as well. People don't want to hear bickering. People don't want to hear excuses. People want to know that our doctors, our nurses, our police officers, our firefighters are protected, period. And so to hear from the federal government that the national stockpile is not for the states, well, who the heck is it for? The states are the nation. And
I wondered
so,
that.
yeah, and so I think it is frustrating, not to get political, simply to be factual. It is frustrating when you see states who are expressing the greatest need not being given what it is they're asking for. You see that breaking down across partisan lines. And I know in the last few days, we're seeing millions of masks being shipped to other countries around the world from the United States,
Yes.
while our first responders continue to suffer here at home. And so it's tough to measure that up against someone whose message has been America first for the last 4 years, while they continue to put our first responders and people on the front lines last. And so it's going to take our governor, it's going to take our legislature, our counties, our cities, everybody pulling out all the stops that they can to get the PPE to where it needs to go. And I think that we're seeing that. We're certainly seeing a lot of elected officials like Representative Hammoud step up to the plate and make sure people get what they need. But if this is going to continue for as long as we expect it to, that need is going to continue to be there for a long period of time, and we need to ramp things up even more.
And I'm glad you mentioned that our PPE is being shipped overseas, because that blew my mind. I could not understand, especially since our men and women are suffering. Henry Ford Hospital, 700 healthcare workers are inflicted. We've got, Beaumont, we've got Sinai. What are we doing with that? I mean, is there, Representative Hammoud, is there a plan in place to be able to call out for emergency healthcare workers to come out to Michigan and sort of lend a hand, or is that something that is not on the table?
So I can speak to what the governor has done, and I also speak to some of the ideas that we have floating to our administration about how we can expand and increase support on the front line. First and foremost, she lacks the certificate of need requirements for many hospitals and many centers, so that they can deploy more resources without having to go through all of the regulatory red tape. Secondly, she relaxed the scope of practice, allowing nurses, PAs, nurse practitioners, so on and so forth, to do more on the front lines without that physician oversight that's 100% necessary all the time. Trying to utilize and maximize, their learnings in schools and employing them on the front line. Secondly, what we're currently working on now is there's a coalition of folk working across the country, and we here would be better positioned in Michigan, frankly, I believe. We have a lot of medically trained personnel who are trained overseas, who practice overseas, but when they came over here, they didn't seek certification, or they weren't granted certification, or didn't land a residency because we have a limited number of residency spots. And so we've actually gathered over 600 names and contact information that we have shared with the governor's office to try to expedite or institute some sort of certification process for them, in hopes that they can quickly come online and assist on the front lines. I can tell you that New Jersey has done this already. They have an executive order allowing any foreign trained medical personnel who have practiced within the last 5 years to kind of jump on in with a benefit afterwards that they'll provide them with a track to become certified here in the States long term. I believe California is on their way as well, and I think New York's also looking at this. And we here in Michigan, frankly, with a large Arab American immigrant population, many of which were trained physicians overseas, are very well positioned to use that immediately on the front line. So we're having those conversations, we're trying to expand on them, and we're hoping that the conversation will prove to be fruitful.
Wonderful, wonderful to hear. So I'm going to go more towards the rumor aspect of this conversation. The 5G network. I've read about it. I have seen a lot of the information out there, and frankly, I mean, it's a bit concerning, especially when you look at the radiation aspect of it, and you look at the effects that it has on human beings. Now, my take on it would be that maybe if someone was had pre-existing condition and was inflicted with COVID-19 or any other kind of thing, that the immune system would be compromised. Now, maybe that's my non-scientific sort of informal understanding of what I've been reading. But Commissioner?
You're gonna let me go first.
Yes.
This is usually when I remind folks that Abdullah is an epidemiologist and he's a scientist, and he should answer the question.
Right.
Yeah,
Start with you.
I'll say this, you know.
But
I
you were
think
the
back
first
to-
one to say you wanted to debunk
Yeah.
it, so we're going to go to him after this.
Yeah, I think back to even my time in the Senate when 4G was coming out, when smart meters were being installed on homes, the whole 9 yards, and obviously the health and wellness of the community is first and foremost in all of our minds, particularly in a crisis like this. What I haven't seen, however, is scientific evidence that would lead me to believe that the establishment or the creation of a 5G network has the type of overwhelming negative medical effects on folks that we're seeing or that we're hearing about across the country. I know I've seen reports out of Europe right now where people are identifying the 5G, I believe transmitters is the right word, and burning them or trying to destroy them, thinking that they're having adverse health effects on the population. So, you know, I've had this conversation on a number of different topics over a number of different years. And in all that time, unfortunately, for the folks who believe strongly in this, I just haven't seen the evidence that would lead me to believe that there's a correlation between the two. I don't know if that is similar to what the representative has seen or knows, but that's certainly what my experience has been.
Okay, we're running a little out of time, but I really need to hear your take on this.
Yes, we do. Yes, we do.
Yeah, I don't think I have anything so profound to add more than what the commissioner already spoke to. I strongly believe that the scientific evidence has not shown overwhelmingly that 5G is somehow causing these wide-ranging health implications for us. So I think we can move forward. We shouldn't cause hysteria around it. We should lead with the facts, look to the research. And I don't think we'd be putting these all over the place if we knew there were very strong detrimental health effects.
I'm glad you mentioned that. So why are we putting these all over the place right now at this particular time? They're popping up everywhere.
So I believe these have actually been installed. They've been being installed for quite some time. There was some really key legislation that passed last term that allowed for the installation and negotiation between the state and local, between the providers and local municipalities. So once that was cleared, then it provided the avenue for them to be installed. And obviously for those working in telecoms, they are considered critical infrastructure employees. So we might just be sitting at home now with more time on our hands, noticing more of the installations happening.
Okay, and that was going to be my question. Are they essential employees to be out there putting these up while everybody else is sheltering in place?
The telecom industry, you are considered a critical infrastructure employee.
Okay. Last words, like maybe 30 seconds.
My last word would simply to be, you know, one, thank you for the opportunity to have this platform to try and get some additional words out. It's great spending time with you and the rep, and the fact that we're flexible in terms of how we're doing it now is just really great. And I will say this, I think the more I'm talking with the community, people are asking more and more questions. They want to know the recovery numbers, the death numbers, the infected numbers. And we're happy to push that information out to folks. But at the end of the day, we know what we need to be doing as a community. We need to stay home. We need to stay home. It's going to drive us crazy. I'm totally getting cabin fever here. But in order to maintain the safety and security of not just ourselves, but the folks around us, the solution to this problem right now, we know is pretty straightforward. To stay home, to wash your hands, to maintain proper PPE, and to only go or to travel when it's absolutely necessary. And so I would just end by encouraging folks to continue to follow those mandates, because the sooner we all get behind that, the sooner we can move past this and get on with our normal lives.
I'll just say
thank you.
Thank you so much. Stay home, stay safe, save lives. David said the rest. So I appreciate it.
Guys, it was wonderful as usual. Again, Commissioner David Knezek, Representative Abdullah Hammoud, thank you both for everything that you do. You will always be the dynamic duo to me. You're amazing. You're always there when I call upon you. I thank you from the bottom of my heart, and thank you for everything you're doing for Wayne County and for Michigan. God bless you both. Everybody, stay safe out there. Wash those hands. Keep your distance. Don't go out unless you absolutely have to. Try to have your groceries delivered. It's really a nice kind of thing to do as well. And also we help employ the people that are delivering, and hope that they stay safe and sound. Thank you all for joining us. Again, thank you, gentlemen. Stay safe. God bless. And we will see you soon. Take care.
Look forward to it. Thank you.
Thank you.